Government employees and public officers are to cancel all non-essential government business travel, according to new Civil Contingencies Emergency Regulations. A bulletin of circulars distributed to all public servants also states they are not to travel on government business to any listed at-risk country, and that they're required to report this within 14 days if they do. The necessary 2-week self-isolation period will have to be taken as certified sick leave, although a medical note will not be required. People arriving from listed countries may be refused entry into Gibraltar, may be detained for tests, or may be isolated. Employees are also being asked to refrain from personal travel to any of the at-risk countries. According to the regulations, staff may be redeployed and the Chief Secretary could cancel annual leave across the public sector, based on operational requirements. Meanwhile, the government has confirmed that visiting restrictions are in place across the elderly residential services sites: Hillsides, John Mackintosh Wing, the Jewish Home, Galpe and Cochrane wards, Bella Vista and Mount Alvernia. 1 visitor is allowed per resident each day between 4 and 8. Except for those in end-of-life care, when 2 visitors are allowed. Private carers are allowed at mealtimes. All visitors are being asked to wash their hands and use alcohol gel upon entering and leaving the premises, and to sign in their names and the names of the residents they're visiting. Masks are being made available to visitors, as well as information leaflets. Senior members of staff and security guards have been based at entry points to answer questions. Within the premises, social activities are being carried out in small groups, with outings and mass postponed. Extra cleaning and disinfecting schedules have been introduced, with staff training also provided on infection control and coronavirus precautions. The government adds regular clinical observations are being carried out on all the residents, and medical hours have been increased. Staff sickness is also being closely monitored. The government adds contingency measures are in place in case there are nursing or cleaning staff shortages.